there's a little synchronous and asynchronous communication between associate primary care providers, which include nurse practitioners and family physicians, and the hospitalists that look after their patients in hospital. This poverty of communication is known to affect the patient care health outcome during and after hospitalization. So the current hospitalists and the primary care providers find it difficult to connect and communicate with each other for many reasons. To name a few, there is no direct number sometimes for the primary care provider, so it's a difficult effort to have the hospitalist connect to them. Both providers don't know each other's schedules, so it's very hard to sometimes coordinate a time for synchronous communication. The associate primary care providers do not know which hospitalists are following their patients in the hospital, and it's also an effort for them to figure that out. Both care providers have heavy workloads and competing priorities, and unfortunately, communicating between each other becomes a low priority. So the aim statement. My project was to increase and to improve communication between hospitalists and primary care providers via the use of the microblog app that was provided by Interior Health. So the change test idea. So I connected with one eager associate primary care provider and his MOA and reviewed the benefits on how to use the microblog app. I had chosen 3 specific ways that the microblog app would benefit or would allow the hospitalists to provide better care for the hospitalized patient. One would be to provide a patient medical profile summary. 2, to arrange for an appointment for synchronous communication between the caregivers. And lastly, to provide a follow-up appointment for the patient before they get discharged from the hospital. So so the plan to teach the primary care provider and his or her MOA for using the microblog app was refined using the PDSA cycle. I went to the primary care provider's office during lunch and spent about 30 minutes speaking to the MOA and the primary care provider. I focused mostly with the MOA on getting them used to the 3 tasks that I mentioned. So one would be to provide a medical profile summary that could be sent through the microblog app, reply to message in microblog for setting up a time for synchronous communication between the providers, and lastly, to provide a follow-up appointment before the patient gets discharged. If the learner found it or they needed the opportunity to refresh their memory on how to do this, I created a short 1 to 2 minute YouTube videos that they could easily refer to that would walk them through the steps. Findings. So the MOA and the primary care provider found the app to be easy to use. The MOA found that their workload was slightly increased, but it was very manageable. The primary care provider really appreciated the opportunity to speak to the hospitalist directly and also to be in the loop on where the patient was in their care. Both overall found it to be helpful and plan on continuing to use it. So from this small pilot project, I felt that it appears to be a feasible communication between the hospitalist and the associate primary care providers. So future state, it would be nice if we could roll out and train all the hospitalists and a majority of the associate primary care providers in Kamloops to use the microblog app. Outcomes that weren't reviewed, but maybe in future study, I believe that using this communication tool, patient outcome and patient satisfaction will improve. Use of the ER would decline. In regards to medication discrepancies after discharge, this would also decline, as well as patients following up on tasks that were assigned to them in regards to follow-up lab work, x-rays would also improve. Sorry, thank you.